This is Don DeBar, reporting from Denver, Colorado. Yesterday, I had the opportunity to attend an event that was sponsored by some local nonprofits and the city of Denver on the issue, as they put it, of homelessness. There were a number of delegates from the Democratic National Convention in attendance, including politicians and a couple of superdelegates, as well as local, municipal, and federal officials who have developed programs that they say will actually end homelessness. First, I spoke with Philip Mangano, who is the chief point person for the federal government on homelessness. This is what he had to say.
And you're with
the United States Interagency Council on Homelessness, usually referred to just as the point person in the federal government on the issue of homelessness.
Okay, welcome.
Thank you so much. Glad to be here.
So, we've heard a lot about Denver's program to deal with homelessness. What's the federal government's role in that?
Well, actually, very early on, I met with Mayor Hickenlooper, and we talked about his creating a 10-year plan here in Denver that was targeted to reduce and end the homelessness of those who are the most vulnerable and disabled. And he rapidly became one of a growing partnership of mayors and county executives around our country. They now number more than 500 mayors and county executives who are partnered through 350 10-year plans to end homelessness. The federal government has been the initiator of that partnership, but it's mayors and county executives on the local level that have brought together stakeholders to create business-oriented, results-focused plans to reduce and end homelessness, and it's working.
The funding for this comes from which programs?
Well, the federal government makes the deepest contribution, of course, on the issue of homelessness. In fact, in Washington, for 7 consecutive years, the resources targeted to homelessness have increased to record levels. In fact, the president's budget for the next fiscal year, which is now before Congress, has more than $5 billion, that's with a B, $5 billion targeted to homeless people. And those resources are increasingly invested in these local 10-year plans. And one of the foremost plans is right here in Denver. You're seeing the kind of results that we've always anticipated on the issue of homelessness. More resources and fewer homeless people, and that's certainly their legacy here in Denver. But the good news is, around the country, in data that's been aggregated from all over the country, there's a 30% decrease in street and chronic homelessness all over our country. It's the first documented national decrease in homelessness in our country's history. So the direction of the investment is right.
What would you say is the estimated number of homeless people in the United States?
On any given night, there are about 700,000 Americans who are experiencing homelessness, but over the course of a year, up to 2 million Americans experience homelessness. Of that number, about 35% are families, with the remainder being single individuals, the people that we see on the streets and long-term in the shelters. And of that larger number, there are about 125,000 people who are either on our streets or long-term in our shelters, the very people that the researchers call people experiencing chronic homelessness. That is, they have a disability and they have long-term homelessness. And one of the federal priorities, which has been adopted by Denver and many cities around the country, is to focus specifically on that population, because without intervention, that population stays homeless. Most other homeless people come in and out of homelessness, according to the research, and make it out on their own or with a little bit of help. But it's this chronic population that tend to be on our streets, long-term in our shelters, but also randomly ricocheting against very expensive health and law enforcement systems. So part of the economic impact of homelessness is now being a focus of the 10-year plans that are being created. We now understand that it's more expensive for people to randomly ricochet into the emergency room of hospitals, into the acute side of substance abuse and mental health programs, police interventions, court and incarceration costs. If you add those up, that's more expensive than people having a place to live, securing a place to live, and the support services necessary to support that tenancy. In the 65 cost studies that are going on across the country, the cost of that random ricocheting ranges from $35,000 to $150,000 per person per year. In those same cities, the cost of providing a place to live with the support services needed is $13,000 to $25,000. So either we can spend $35,000 to $150,000, people continue to cycle through homelessness, or we can spend $12,000 to $25,000 and literally end their homelessness. Well, you don't need to be Warren Buffett to figure out which of those is the better investment.
In terms of impact, the president's initiative, what year did that begin?
It began in his 2003 budget to Congress, where he asked the country, set a new marker in front of the country, which was to end the homelessness of those who were the most vulnerable, the most disabled, those on our streets and long-term in our shelters. So 2003 was the kickoff for it, and I would say that things really got rolling about a year later in 2004.
So the 10-year plan about halfway through. So
well, we're about 4 years into it, but every city has adopted it. So, for example, just last week I was up in Fort Collins, Colorado. They're just beginning to launch their 10-year plan, as opposed to Denver that's been doing it for about 3 years. This isn't a federally, or no one in a corner office in Washington is determining what the plan will be in local communities. We're not writing a plan and then mailing it to communities saying, implement this, it'll be great. Quite the opposite. We're partnering with communities. They're developing their own 10-year plan, and then they're rolling it out. So the dates are staggered. So Denver started 3 years ago. Fort Collins will start their 10-year plan implementation in probably a year from now. So it's staggered, but the cumulative impact is that the numbers of people on our streets and long-term in our shelters is going down. And I think that's the number that we've always looked for in homelessness. It's not a growth industry like energy or high tech where we want to see increased numbers. Actually, in homelessness, we want to see the numbers diminished. So
when you start whatever initiative you start at the federal level, and people develop plans locally, none of that takes place in this condition of stasis. You also have the housing market, rising costs,
of course,
and funding problems. I know, for example, in the handout here, they're looking at Fannie Mae as a source of funding for programs, and I haven't seen the Wall Street Journal today, but have they filed, for bankruptcy? The run-up in real estate costs that just ended last year, and rents also has a severe impact. And how can the coping strategies that are being developed take into account that you can basically be farming new homeless people because people get priced out of their existing housing and backfilling whoever's handled in this?
Well, actually, for a long time, that's exactly what homelessness, if you could call it policy, was about. We were moving people out, more people were falling in. We were essentially just bailing the leaking boat of homelessness. Well, in the last several years, what we've done is we've reprioritized prevention to be equal to intervention. So now there are a number of prevention models around the country, both in 10-year plan cities and advocated by the federal government. So, for example, in addition to the $5 billion that we're investing in intervention resources, the president has also put into his budget, and the Congress has gone along, more resources for people who, through the research we know, are at risk of falling to homelessness. People exiting prisons and jails, young people aging out of foster care, people in need of substance abuse and mental health care. And now, of course, the Congress took action in the housing bill, which the president signed, to put $3.9 billion, nearly $4 billion, targeted to people at the local level, because those CDB dollars, the Community Development Block Grant dollars, will go to local communities. Those $3.9 billion are targeted specifically to the foreclosure crisis. So while we have a lot of macro strategy going on, the Treasury Secretary talking to Fannie Mae and Freddie Mac, and at that level, and it's important to secure those institutions, now there's an opportunity at the micro level to make a significant difference on this issue by virtue of the investment of the nearly $4 billion to really put put a tourniquet on the hemorrhaging of people who are coming out of the foreclosure crisis. So what's been important is to prioritize a prevention strategy along with the intervention strategy. That's what's moving forward. You would see that in Denver's plan, and you would see that in plans across the country.
The handout from the Colorado Coalition for the Homeless lists 5 fundamental strategies, and the first item that they have is a $3 billion annual funding, apparently this ongoing, and the McKinney-Vento Homeless Assistance Program. Mm-hmm. They're looking at a $3 billion nut there, and just in terms of newly cycled people in danger, you're talking about throwing $4 billion at that. And Section 8, I guess, is one of the funding streams also, and that's actually declined, right, in the last...
No. There's never been you can't find in the budget document. You can find in advocacy speak that there are declines. But if you actually look at the documents, if people did their homework, there's never actually been a dollar decline in that program, the Section 8 program.
Then I spoke with Mayor Sheila Dixon of Baltimore. She had this to say.
So I'm sitting with Mayor Sheila Dixon from Baltimore. Welcome.
Thank you.
And, first, could you state the problem of homelessness in the city of Baltimore? How long have you been mayor of Baltimore, first of all?
Well, I've been mayor of Baltimore for almost 2 years. I was city council president, finished out the term for Martin O'Malley, who's our governor, and then was elected mayor, so it's almost 2 years. And we have a major problem of homelessness in Baltimore on all fronts: disabled, senior citizens, families, mentally disturbed individuals, veterans, and we really hadn't had a plan. And as the transition took place before becoming mayor, I looked at what other cities were doing through the U.S. Conference of Mayors, and we then I pulled together a task force to actually create our 10-year plan. And in essence, since that plan was adopted, we've actually made some really great progress.
What are the points where you think leveraging are most effective in terms of dealing with homeless problem in Baltimore?
Well, I think where we need to leverage is first and foremost having the fiscal support and resources to provide housing first, and then provide the wraparound services that are needed based on each individual case. And that's so significant to make a difference to end it. If it's seniors or veterans, and particularly new population, which are families. And so we try to find shelter with housing first, and then wraparound services through various means with state and local organizations.
What kind of funding sources do you have?
Well, we receive minimum but some funding from the federal government. We have creatively worked through our housing department in supporting our efforts, and we use the services that already exist to help in making sure that we connect people with social services, DSS, Medicaid, Medicare, all of the programs that exist, but people who tend to be homeless tend to be the last to get support in reference to that, but we also get federal support.
One of the problems that I know in New York that we had with delivering services to homeless people was that you need an address to be eligible.
Address, identification, and that's one of the areas that we first start with when we go out and send workers into the street, and we are able to capture them, is to get an address, to get an ID for them, so in order to fill out the appropriate forms. So we assist them from A to Z to make sure that their lives move smoothly into providing the housing first, and then looking at what they're eligible for.
What could the federal government be doing that it's not doing to support?
Well, of course, I think where the federal government could come more in line is by providing more assistance to local jurisdictions, particularly in the fiscal support for housing and capital, as well as to make sure that those agencies that provide, if it's employment opportunities, if it's medical support, or if it's mental health support, that we have the appropriate funding within those organizations that can accommodate, the number of people that need the intensive, in some cases, support.
With the efforts to reduce homelessness or to eradicate it among people that are homeless now or in immediate danger, you have a larger condition in the marketplace with the housing collapse, subprime loan crisis and such, where it's almost like a homeless farm that people are in danger that were never considered as part of the equation. How do you anticipate dealing with that should you end up seeing streams of more homeless people?
Well, we actually now see a new population of homelessness, particularly families, as a result of the foreclosure. And the city has actually, under my administration, are actually suing one of those mortgage companies, Wells Fargo, because we've identified them as being doing reverse redlining. We've also passed, during this last legislative session, state legislation through the U.S. Conference of Mayors. There's a committee working with the banking industry. So there are a number of efforts that are going on. And here again, this is where the federal government could play an even more tremendous role in providing assistance in affordable housing, because that's a key. Getting quality, affordable housing and getting those individuals into the appropriate housing, along with changing some regulations as relates to the real estate and mortgage, and to eliminate foreclosure.
Anything else that you think the audience needs to know about the efforts in Baltimore or nationally to deal with the homelessness issue?
Well, I think every city in America can reflect and talk about the importance of ending homelessness. That's why many cities have joined forces through the U.S. Conference of Mayors. And I think that the message that we need to send is that in these efforts, we need everyone to be involved to assist in this process. And what I can say in Baltimore that is happening, it's really been an eye-opener when we get volunteers to come and work with us at our 24-hour shelter, or to assist us under the bridge where we have individuals meet as we ship them, bus them to locations. And so it really starts at a real grassroots level as well, but also to make sure that when we get one's attention who made the choice to be homeless, that they have the kind of trust in those of us involved in government that will take advantage of it. Because ultimately, the bottom line is we want people to come back out into society, be a productive citizen, not relying on the support, but coming back and being a functional, productive citizen.
Dixon, thank you very much. Thanks a lot.
No matter who the next president of the United States is, there are many of our fellow human beings living within the territorial boundaries of the United States that have no indoor space to live. That has to change, and at the present, although it appears to be on the rhetorical agenda of politicians all across the country, it remains to be seen what the real agenda really is. From Denver, Colorado, this is Don DeBar for Wake Up Call.